Hey guys, it's Nikki. Welcome back to another video. I feel like I haven't said that in a long time, but today's video is going to be shifting gears a little bit. It's going to be a little bit different. We're going to be talking about what it's like working in the ER. I currently work in the emergency department at a level 1 trauma center as an ER tech. So I'm going to be sharing with you guys how I got the job, what made me switch gears from where I was, and my tips and tricks on recommending if you're looking into getting into emergency care. Before we go on, don't forget to give this video a big thumbs up and subscribe for more content every week, and let's go ahead and get into it. Okay, so to start off, working in the emergency department, especially as a ER tech, is a very competitive field. If you want me to be 100% transparent, you have to have some type of experience before getting into that type of field, because if you don't, you're most likely not gonna get it on the first hand. It's also a lot to learn. So if you are not up to date on basic medical terms or haven't been in the field long enough to know what certain things mean, then you're gonna be struggling your first couple months, if not your first year on the job, trying to figure out what certain terms mean as far as chief complaints, and also figuring out kind of course of treatment and how to be active on the care team and kind of have an idea what scans are going to be done, what they're going to be doing, roughly how long it's going to take, and everything like that. So to start off, you definitely want to get some type of medical certification of some sort. I have my CNA. Typically to work in the ER, you have to have your CNA or be at least an EMT or firefighter, or be in nursing school or some type of paramedicine program. You can be in any medical program in school and still apply. However, someone that's had more experience in a hospital setting or in that role in general is probably gonna have a leg up when it comes to getting a job in the ER. I got my CNA in 2019 and immediately started working as a CNA. I worked in the same hospital, but I worked in oncology in our treatment and infusion center, which is an outpatient center where cancer patients get their treatments and their infusions. We also see non-cancer patients as well that go in with their treatments, but primarily of the patients that we saw were cancer related. Being in that field, it caused for really getting to make a connection with patients, and also working hand in hand with oncology. You got to see patients on their best days and you got to see patients on their worst, sickest days. So you kind of had a toss-up of experience as far as how people acted, how people were, and pretty much your role was to do vitals, to check blood sugars, and basically just make the patient comfortable. And we didn't have to do anything like bathing. We helped with the restroom, but 90% of the people were independent. So really all you had to do was just do their vitals and comfort them, and then they leave. I was in the treatment center, I want to say, for about a year and a half. I started, no, it wasn't. It was just a little over a year, actually. I started in October of 2019 in the treatment center, and then I had switched to emergency care. Actually, it was the week of Christmas, December of 2020. So I had just been there for a little over a year. I am currently in respiratory therapy school, so I knew that I wanted to transition into an emergency critical care role, because that was what I was more interested in, and I knew that that's what would benefit me being in school. And also when I start clinical, I know that that's going to benefit me even more. So I'm happy that I switched, but the transition was definitely very, very different. First of all, the interview process was really difficult. I interviewed when they were hiring several positions, so I probably was like the 5th or 6th candidate that they interviewed, and luckily I had gotten the job offer the very next day, which was fantastic news. That was something that I'm so happy about. but they actually told my nurse manager on my old unit before I found out, and my nurse manager delivered the news personally to let me know. So that was really cool, and a lot of it was because I was transferring units. I wasn't actually leaving my role, but it counted as a promotion because going from a floor tech to an ER tech, there are several different trainings and several different things that you have to do before you can officially start on the floor. So a lot of it is on the floor. Whenever a critical event happens or like an emergent event happens, typically you call an RRT, which is a rapid response team. They're like a critical emergent team that comes and basically will assess the patient, do what they need to do, and then they're off to the emergency room. Or you have the code team, which is basically in charge of doing code blues on the unit and in the outpatient units, and they're in charge of responding if something like that happens so they can get them to the emergency room. In the ER, you don't have that. You are the code team, and usually the ER tech's role in the code is doing compressions. That was something that I've never really done before. I did it one time before I went down to the ER, but that was like a one and done time. I've never done like actual like 2-minute going compressions. I did them for like not even 2 minutes. It was 30 and 2 on my old unit, and that was before the code team got there. So like it was a completely different world going from doing 30 and 2 and then a code team takes over to doing 2-minute compressions. And I'll tell you, even now I'm very experienced with compressions. Doing 2-minute compressions is a long time and very tiring. That's definitely something that I would definitely learn how to practice with, keep up with, because if you don't know what you're doing, it's a rough way to learn. Also in the ER, my ER is a stroke center as well. So we do handle stroke patients. We also have a cath lab, so we handle STEMIs, which is heart attacks. So as a tech, you have to be trained in an EKG reading, and if you don't know what an EKG is, it's an electrocardiogram. It takes a picture of your heart rhythm and also tells us like your cardiac levels and everything. And it takes a picture of your rhythm, and the doctor can read it, and that will basically display if you're having a heart attack, do you not have a heart attack, do you have an abnormal rhythm, like, and anything like that. EKGs were probably the hardest for me to learn because I'd never done anything like that before. So having to learn how to take an EKG, we don't officially read them, we give them to the doctor, but as you take the EKGs, you kind of start to learn what certain things look like, and you start to learn what certain numbers mean and everything. So even though we don't technically give the official reading on a diagnosis for an EKG, we still kind of have an idea what it says. But for EKGs, you do a 12 lead, and then obviously you learn the difference of a right-sided, posterior. Usually you do those in heart attack situations, which is a STEMI, and then you also learn how to do a pediatric EKG as well. So now that I've kind of talked about what the ER is like, let's talk about what I think you should do to get to the ER. First of all, it's very, very difficult. You're probably gonna have like a 1 in 10 chance of getting in the ER first thing right off the bat, freshly new as a CNA or EMT, without any patient experience or hospital experience. A lot of the people that I know that work in the ER came from a different unit or came from having some type of experience at a different hospital. Maybe they have EMT experience in the field. So it's very, very rare. And in fact, I don't think any of our ER techs right now got hired brand new. They've had experience elsewhere, and that is basically why they are where they are now. Usually to get to the ER, you at least need to have a year of experience in a hospital. 90% of the people we have hired came, like I said, from a hospital unit or we're an EMT or firefighter in the field, so they're around critical situations all the time. So I would definitely recommend making sure that you try to be in a hospital setting, or at least try to be in like some type of long care facility, somewhere where you're dealing with a little bit more critical patients. But also just know getting in the ER is very competitive. But the ER is not for everybody. We've had people that have applied, they've been super excited, and then they actually get in the ER, see what it's like, and then they never want to do it again, and they decide it's not for them. Being around people that are severely injured, you're around lots of bodily fluids, you're around a lot of blood, like you're seeing things and experiencing things that you can't talk about, and you're seeing things that nobody should see, and you're just, the overall experience is really kind of just, especially if you're not used to seeing something like that. I mean, if you come from an area that's not used to seeing critical patients or seeing very severely injured patients or coding patients, then you're gonna have a very huge wake-up call when you are in the ER. My biggest recommendation is if you're gonna try to get into any unit in a hospital, I would try to do kind of more of a critical care unit. I would try to do more of an ICU, or kind of more of a faster paced unit that's always going to keep you on your toes. The reason why I say that is because the ER is so fast paced that if you're not used to that type of speed and you're not used to constantly having to do things for patients and do vitals, do blood sugars, take them to their scans, help them to the restroom, like it's like normal CNA duties, except you're trained in EKGs, you're trained what to do in STEMIs, you're trained what to do in strokes, you're in charge of compressions and leading compressions as a tech in a code. You know, you're in charge of watching out for certain signs, because not everyone is going to be in an ER room at all times. We could have a patient that's completely fine, and then you could walk into the room and they're seizing, their heart rate could have completely bradyed down to like 20 after they were at like 80. You know, there's so many things that can go wrong so fast in the ER, and you have to be prepared for anything, and you have to be ready to know what to do at a flip of a switch if something like that happens. That's why I definitely recommend being in more of a critical setting as far as where you're gonna go before the ER. That is something I wish I personally would have done. I think that it would have made life a little bit easier, because I definitely had a rough, hard first few months. I really was debating, do I really want to work in the ER? And now, I mean, I love where I work, I love what I do, and obviously I'm advancing my career in school, so I'm not going to be an ER tech for forever, but I definitely think as a CNA it's a great position to be in. Next thing is there's so many different shifts when it comes to the ER. Usually on the floor you have 7 to 7 day and night shift. In the ER we have multiple shifts, just because we need to have multiple people on the floor at all times. We have about 3 different shifts in the ER. For techs, we have a day shift, which is 7 to 7. We have overnights, which is 7 to 7, just PM to AM. And then we have day shift and night shift mid shifts. So the day shift mid shift is 10s and 11s, and basically that means you alternate working 10 a.m. to 10 p.m. or 11 a.m. to 11 p.m. Or you have a night mid shift with it, which is 1s and 3s, which is the same thing, except you work 1 p.m. to 1 a.m. and 3 p.m. to 3 a.m. We only offer 12-hour shifts in the ER unless you decide to pick up bonus. A bonus shift can be anywhere between 4 to 12 hours, depending on what your FTE is. My FTE, I am part-time, so I'm only required to work 24 hours a week, and anything I pick up after that is considered bonus. So I'm only required to work 2 12s a week unless I decide to pick up extra. Sometimes I like to, sometimes I don't. It really just depends on the weeks And it also really just depends how staffing is. Full-time would obviously be 3 12s a week. And then you do have casual, which technically if you're casual, you have to work, I think, 24 hours in a month. But you don't have to be like on a weekly basis, or you could be PRN, which is you just work as needed. So basically you're not assigned at that point to any holidays or anything. You basically just put your availability, and if you don't work 3 months down the road, then you don't work 3 months down the road. So that's just kind of how that works. But be prepared that you will be working long, hard 12-hour shifts. You're required to get a break. I'm gonna be honest, in the ER, that doesn't always happen. You're so busy sometimes, and you a lot of times have more patients than you do staff. So at that point in time, everyone has to work together, and unfortunately, you might not get a break. It sucks, and not everyone understands that that's just how it works. You know, on the floors, you're required to get a break, whereas in ER, you might not get one. So that is another thing to kind of be aware of, is if you're coming from another unit where they require you to eat, just know that you might be doing a lot of snacking in between patients because you won't have time to sit down and have a full meal. There's times where we have over 100+ patients on the board in the ER and we only have like 20 something staff members. That's a lot. Obviously at that point, wait times are going to be long, scan times are going to be long, you know, waiting to see a doctor, because there's only so many people that work there before it gets to be really overboard. And a lot of times, especially we're in our summer census numbers right now, it gets insane. So just be prepared that you're always going to be moving. There's always going to be something to do, whether a patient leaves and you got to flip the room, whether your patient's got to go to CT and then they got to go to x-ray, and then right after that they have to get an ultrasound. Just be prepared of like, what can I do while my patient's scanning? I can go get vitals on this patient. I can go get a UA on this patient. I can make sure that this patient's comfortable. Does this patient need a blood sugar? Like, there's just so many different things to constantly be aware of. Or do I have an ICU patient that's going to be going up to the ICU? So that's taking up majority of my time because I have to constantly help monitor that patient, transfer that patient with the nurse. And, you know, there's just so many things like that. So just, I would always recommend coming from an area that really keeps you on your toes. Also, when you get to work in the ER, you don't necessarily get to pick your shift. I was hired on, I've been on all 3 shifts, and I'm finally on day shift after almost 2 years of being in the ER. I started off on night shift. I was actually on night shift for about a year, and then I went to 10s and 11s, and then I was on that for like 5 months, and then they actually had switched me to day shift because an opening had opened. And originally when I started, I wanted to be on day shift. So it took about a year and a half for me to actually get on the shift that I originally wanted. But that's just because day shift and night shift usually are the shifts that are going to be filled first. You don't see a lot of turnover when it comes to days, just because of the fact that, unfortunately, everybody wants day shift. You know, it's not ideal to be working a night shift forever. Some people love it, but for some people, like, it's doable for about a year or 2, and then after that, you just gotta get off nights because your body just gets sick of it. But just know that sometimes you don't really get the choice. If you're wanting a position in the ER, you're gonna take what you can get, and then from there, you're gonna have to work your way up. And that's another thing with the ER is we do constant evals, and we always do meetings with our management. So just know that if you're not pulling your weight or doing your job, you most likely will get talked to. And if you're doing a really good job, you're gonna get praised for that, and you're gonna get different opportunities that other people wouldn't get just because you're doing a good job, you're doing your work the way you should, and you're taking care of patients the way you should. So I definitely say if you're gonna work in the ER, you need to prove why you were hired and why you deserve to be there and what you're gonna do to better yourself and make the department better. Because the last thing you wanna do is work in the ER and try to be lazy. there's no room to be lazy, especially when we're busy. I get it. Sometimes in the mornings, you could have 10 patients on the board. So at that point, yeah, there might be a little bit more leeway as far as like what you can do. You can stock your rooms, you might have downtime for a while. But in the ER, you could go from having 10 patients to 70 patients within 20 minutes. So it's just kind of a thing where, you know, just always be prepared and expect the unexpected. But, you know, it's definitely one of those jobs that you can't just come in and expect to relax and put your feet up and think that it's going to be a vacation, because it's not. Coming from my old unit, I definitely learned very quickly, even being on night shift. Like, a lot of people think night shift is super easy because the patients are sleeping. No, they're not. Honestly, if you're in the hospital, I think a lot of people know this if they've stayed in the hospital. You don't get a lot of sleep. And the reason why you don't get a lot of sleep is because you have timed meds, you have timed vitals, you even have scans that you might have to get in the middle of the night. So it's kind of one of those things where it's like, you might not want to go to a hospital if you plan on getting sleep. But no shifts have it easy, and usually night shift, I mean, you can see critical things on every shift, but night shift usually gets some of the really worst stuff because you get a lot of drunk driving. Now, don't get me wrong, there's drunk driving during the day, but especially at nighttime on the weekends, you get a lot of crime, a lot of drunk driving and everything. So like I said, just kind of be prepared for everything and be prepared for anything. Another big thing I have to say when wanting to go down to the ER is be prepared to be working on all ages. Working in the ER, there's not an age limit. It's 24/7, all ages. You could see anywhere from a baby that's 2 weeks old to an adult that's 95 to 100. So just know that there's all ages in the ER, so you kind of have to be up to date on all vital signs and kind of be aware of all types of illnesses for each. That's what kind of makes it really hard in the ER, is sometimes you have to shift from an adult to a baby. And not only when it comes to kids and infants, but you also have parents. And in our ER, as of right now with COVID, we only allow 2 visitors per patient and they can't switch out. And then with kids, obviously they can have 2 people with them at all times because they're a minor. They're required to have a visitor with them just because they are under the age of 19. But it gets really hard when it's a baby because they can't tell you what's wrong and the parent's really worried. So you just kind of have to reassure everyone that, like, you know what you're doing and you can't look scared, because if you look scared, especially taking care of an infant or a baby, the parent is gonna know, they're gonna call you out on it, and it's definitely not gonna make the experience better for you. So definitely just treat every patient with respect and treat them how you would want your family member to be treated, and always just give good care. That patient could be a complete butthole to you, or their family member could be a complete butthole to you. Definitely don't sit there and be disrespectful to them back, but don't take it either. Like, you know, you got to understand that everyone deals with pain and deals with everything differently, but also at the same time, people got to understand too that they're not the only patient there. So you can deal with a lot of disrespect in the ER. I feel like every unit deals with disrespect, but especially in the ER, I feel like that's where a lot of people think that they can just talk back. I mean, I've been called names, and that's something, like, if you're sensitive or you take things very personally, I'm gonna be honest and say, I don't know if the ER will be for you. Patients say things to you and they like to dig deep and try to hurt you. You can't let it get to you personally, and you can't take it personally, because at the end of the day, they're just trying to be mean, and unfortunately, you can't let them know that they're being mean, because then they're just going to continue to do it and push your buttons. Usually people that work in the ER have a name for themselves. Like, a lot of people consider, like, ER workers to kind of be like, I don't care, mean people, because a lot of it is we just don't put up with crap and everything. So that's kind of one of the other thing is too, is stand up for yourself, but also be very professional when taking care of someone and give them the best care, even if you feel like they don't deserve it. But yeah, I think that's all I'm gonna talk about today. If you guys have any questions about anything else, or if there's anything that I didn't mention, please leave it down below in the comments. I'll try to respond if I get anything, or even I could make a part 2 asking with your guys' questions if you have questions about the ER and what it's like working there. But yeah, I hope you guys enjoyed today's video. Again, don't forget to give it a big thumbs up, and don't forget to follow my social media down below and hit that bell button. That way you're notified when I upload a new video. But yeah, I love you guys. Thank you so much for watching, and I will see you in my next video. Bye.